Time now for this week's mental health moment, and we've seen the statistics. Maine teen suicide rates exceed the national rates, and 36% of Maine high school students report feeling sad or hopeless. But how do we address this mental health crisis both today and in the future? Here with us in studio is Jane Van Bramer. She's Sweetzer's president and CEO, and she's talking one-on-one with us about potential solutions. So Jane, thanks so much for joining us today. So we'll jump right into it. How do we get Maine youth the mental health support that they need?
Well, Sweetzer believes the best mechanism for impacting the youth mental health crisis is to reach children early on in school settings. Children spend the majority of their day in educational settings, and these settings allow healers to collaborate and communicate with coaches and teachers who may observe challenging situations and problematic behaviors that might not be seen at home. So these settings also really do help with eliminating barriers to treatment. Parents don't have to worry about making appointments or driving a child to therapy, and they reduce the stigma associated with receiving behavioral health services. Hearing someone say, "I'm going to guidance," or "I got called to guidance," is very normal and routine in a school setting.
That's true. So what about availability, though? Does every school district really have these mental health professionals available? And if they don't, why don't they?
So Sweetzer has therapists co-located in over 100 public schools, and we work currently with 25 different school districts, but we are just scratching the surface. And there are other providers that are working with other school districts, but it is far from in every school district. Our therapists work 12 months a year. They stand at the ready to see kids during the school day and will travel to families' homes to work with families. We've literally helped thousands of Maine youth navigate bullying, anxiety, depression, parental divorce, and other adverse childhood experiences. We do need every school district to partner with a behavioral health provider. So why isn't it everywhere? It's a simple answer, and it's cost.
Money, yeah.
Cost to the school district.
What can be done to address that cost problem?
Well, we are working with the Speaker of the House, Rachel Talbot Ross, on LD 2002, and this is a bill that would help subsidize in-school therapy services. It's actually a grant-like incentive program that would give money to schools to partner with a behavioral health provider to provide in-school therapy services. This would reduce the cost to the schools. It would make it financially sustainable for providers like Sweetzer. Right now, we operate that program at a loss every single year. We sustain it with revenue from other programs and donations because we believe so passionately in the preventive aspect of it. But there is money available, and Maine is seeing a surplus of several $100 million. The time to act is now to support LD 2002. Please, we're asking the public to reach out to their representative or their senator. You know, this is something that is really needed for our youth. The time to act is now.
And it's definitely important to get involved, especially if you want to see that bill go through.